Welcome back to my channel. Please subscribe to my YouTube channel and click the notification bell for more rad-clusive videos. Today we are going to discuss magnetic resonance imaging, or MRI. The Nobel Assembly at Karolinska Institute has decided to award the Nobel Prize in Physiology or Medicine for 2003 jointly to Paul Lauterbur and Peter Mansfield for their discoveries concerning magnetic resonance imaging, or MRI. Paul Lauterbur and Peter Mansfield are considered the father of magnetic resonance imaging because of their great contribution in the field of medicine and in the field of MRI. In the 1930s, a physics phenomenon was discovered called nuclear magnetic resonance, or NMR. Felix Bloch, working in Stanford University, and Edward Purcell from Harvard University discovered NMR. In NMR, nuclei were placed in a magnetic field. They absorbed energy in the radiofrequency range of the electromagnetic spectrum and re-emitted this energy when the nuclei transferred to the original state. This phenomenon was termed NMR as follows. Nuclear, as only the nuclei of certain atoms reacted in that way. Magnetic, as a magnetic field was required, and resonance because of direct frequency dependence of the magnetic and radiofrequency fields. For their discovery of NMR, Bloch and Purcell were awarded the Nobel Prize for Physics in 1952. Use of NMR to investigate the chemical composition and physical structure of matter. Relaxation times T1 and T2, wherein T1 is the time taken by nuclei in the test samples to return to their natural assignment or alignment, and T2 is the duration of the magnetic signal from the sample. In 1970s, Raymond Damadian proposed that each tissue in the body has a different relaxation time, but cancerous tissue has an abnormally long relaxation time. He believed that the NMR could be used as an external probe for the internal detection of cancer. Damadian presented the first commercial NMR scanner at the annual meeting of the American Röntgen Ray Society in 1980. Paul Lauterbur determined the origin of the radio waves by analysis of their characteristics, discovered the possibility to create a two-dimensional picture by introducing gradients in magnetic fields. In 1972, obtained the first MRI. Peter Mansfield further developed the utilization of gradients in the magnetic field. Signals could be mathematically analyzed, showed how extremely fast imaging could be achievable, and in 1976, he and his colleagues created the first MRI of human body part, which is a finger. What is an MRI? An MRI, or magnetic resonance imaging, is a safe and non-invasive test. It is a diagnostic technique, uses strong magnetic field and pulse of radio waves. It produces pictures of structures inside the body. The images are the slices of an organ or part of the body. MRI computer is a 3D images. How MRI works? Our body serves a strong magnetic field. The machine uses a very strong magnetic field and pulses of radio waves. The machine creates an image, how hydrogen atoms react. Usually, images are created as single slices of organs or structure. MRI computer combine them to give a 3D image. Because of the predictions from physics and math, we know there are very weak magnets in all living tissues. These magnets are atoms with unpaired numbers of protons and electrons, like hydrogen. There are billions and billions of hydrogens in our body. Using our body's magnet is one way to stick these very weakly magnetic tissues in a gigantic, strong magnet and see what happens. This is the principle of magnetic resonance imaging used in research and diagnostic radiology today. A moving electric charge produces a magnetic field. As the magnet interacts with hydrogen atoms, it wobbles or spins into one direction. The protons produce a small magnetic field. When there is no external field, the hydrogen atoms are randomly aligned into different directions. On the other hand, when there is an external field, all hydrogen atoms are aligned with field and spin or wobbles into one direction. When magnetic fields interact with the body, some protons aligns against the field and some protons aligns with the field. Protons continually oscillate or wobbles that always a slight excess aligning with the field and aligning with the field with slightly lower energy state. The image shows MRI of the brain with sagittal view with different parameters used. On T1 contrast parameter, the echo time is 14 milliseconds and the repetition time is 100. On the T2 parameter, contrast, echo time is 100 milliseconds while the repetition time is 1500. Lastly, the proton density parameter with the echo time of 14 milliseconds and 1500 repetition time. This image illustrates the MRI of the brain axial view with different parameters used, such as the T1, the T2, and the proton density parameter. What are the advantages of MRI? MRI is used in diagnosing multiple sclerosis, used to diagnose tumors of the pituitary gland and the brain. It also serves to diagnose infections in the brain, spine, or joints. Also visualize torn ligaments in the wrist, knee, and ankle. MRI used to visualize shoulder injuries, diagnose tendonitis, evaluating masses in the soft tissue of the body, also evaluates bone tumors, cysts, and bulging or herniated disc in the spine, as well as diagnosing strokes in the earliest stages. Listed are the disadvantages of MRI. MRI is not for everybody. Machine makes a tremendous amount of noise. It requires patients to hold very still for extended period of time. Orthopedic hardware such as screws, plates, artificial joints in the area of scan can cause severe artifacts or distortion on the image. Aside from that, it is very expensive. We hope that in the near future, an MRI are very small scanners. Functional brain mapping is also used. Ventilation dynamics of lungs through the use of hyperpolarized helium-3 gas is also used. Image stroke in the earliest stages should be detected, and limitless future.